All right, we've got a few folks who dialed in early on our inbound participant line. Thanks so much for joining this live forum tonight. You're on a live teletown hall with California's 20th Congressional District, and we're dialing out live to your neighbors right now. We appreciate your patience as we get started. We've got your Congressman, Jimmy Panetta, here on the line to give you some updates, some accurate information on COVID-19, the coronavirus, and we'll be taking questions as well. So stay tuned for that, and I'll tell you how you can participate in tonight's live teletown hall. Again, thanks for joining us. We're dialing out to tens of thousands of residents of California's 20th Congressional District right now. This is a live town hall forum with your Congressman, Jimmy Panetta. We're dialing out to the 20th Congressional District right now to provide accurate and up-to-date information on COVID-19, the novel coronavirus. Congressman Panetta has assembled a panel of public health experts to provide information and help answer your questions tonight. So we will get updates from the Congressman and our public health expert panel, but while you're listening, be thinking about questions you want to ask during the live Q&A portion of our forum. Then, as soon as you have a question to submit for Q&A, press 0 to speak to an operator and give your question to your operator. You will have the opportunity to ask your question live, but if you're not comfortable asking your question live, that's fine. Just let your operator know when you speak to them that you want me to read your question instead of bringing you live on the air. Again, whatever is more comfortable for you, just press 0 to submit your question to an operator, and then let them know if you want me to read your question instead of bringing you live. And if you'd like to get updates from Congressman Panetta via email, you can just press 7 on your phone to speak to an operator and give them your email address for updates. Again, you can press 7 now to get email updates from Congressman Panetta, and we will keep you updated digitally moving forward. I'll repeat this introduction once more through, and then we'll get started. Again, we're dialing out to tens of thousands of residents of California's 20th Congressional District, and we have your Congressman Jimmy Panetta on the line. He has assembled a panel of public health experts to help answer your questions on COVID-19 tonight, and we're going to be taking questions for most of our forum, but we will provide you updates first. So we'll hear from each of our public health experts and the Congressman, and as you're listening, be thinking about questions you'd like to submit live in our forum. When you have a question you want to submit, you can do that by pressing 0 on your phone. And then when you speak to your operator, give them your question, and you'll have the opportunity to ask it live. If you're not comfortable asking your question live, let your operator know you want me to read it for you. Again, whatever's more comfortable for you. And once again, we'd really like to keep you updated electronically moving forward. So if you'd like to get email updates from Congressman Panetta's office, you can do that by pressing 7 on your phone right now and getting in the queue to give us your email address. We get a little bit of a backlog there, but press 7 now and we'll get an operator with you as quickly as we can to get your email address and make sure we keep you better updated in the future. So again, 7 for email, 0 if you'd like to submit a question for the Q&A portion of our forum. Stay tuned, grab a pen and a piece of paper to write down any important information we have for you tonight. That can be really valuable. So again, 0 for questions, 7 to give us your email address for updates. And it's my pleasure to kick off this teletown hall by turning it over to your representative for the 20th Congressional District of California, Jimmy Panetta. Go ahead, please, Congressman.
Hey, Ian, thank you very much. And let me thank my our experts that are on the phone, which I'll get to introducing in a little bit. And then most importantly, thanks to all of the callers that are participating in this telephone town hall tonight on this Friday evening, March 20th. We had several public town halls scheduled for this week, but unfortunately, based on the conditions that we're all enduring with this bruising pandemic, those had to be canceled, and we have to abide by the distancing standards, the physical distancing standards that have been put in place, obviously, as well as the directives from our state and counties. And so we're going to operate with this telephone town hall, which I participated in one last night with Congresswoman Eshoo, and I heard it was very productive for the participants as well. We'll look forward to doing more of these as the duration of this pandemic lasts and these conditions last. So I look forward to continuing these going forward. But I just wanted to obviously say thank you and hope tonight that we'll be able to try to answer some of your questions about this pandemic, but also try to talk about what we're doing to protect our community members and preserve our economy at pretty much all levels. I've said, and I will continue to say, at least for now, that I do believe that the coronavirus pandemic is going to get worse before it gets better. We're dealing with a very, very difficult to detect and easily communicable disease that really makes it hard to contain at this point. I do believe that invaluable preparation time was lost at first, but now I'm seeing, and I think we're feeling, that our government is taking decisive steps to really fight back on this virus. What you're seeing is sort of a decentralized strategy, as I'll call it, where it's locally executed, state mandated, and federally funded. And through that strategy, I think we're realizing that it's better to be over-prepared than under-prepared. Who do we want to be like? Do we want to be like China or Italy or South Korea going forward? And that's how we have to look to those in order to take the steps necessary to prevent and subdue this virus as best as we can. Now, I do believe that exemplary leadership has been demonstrated recently by our governors, state representatives, our local leaders, our public health officials, and I will say in the United States Congress, where we are passing bipartisan pieces of legislation to prepare and to protect our public health system, our personal safety, and what you're going to hear about, if asked, if necessary, our financial security. Federally, the House of Representatives is doing its part to ensure that the federal government, as I like to say it, is actually doing its job for you, providing the necessary responses and resources to protect and preserve our families, our economy, and ultimately our way of life. I say that because if you look at the recent emergency bills that we have passed, 2 weeks ago we passed the Coronavirus Preparedness and Response Supplemental Appropriations Act. Last week we passed the Families First Coronavirus Response Act. And I believe we've been working on it this week, but I think next week you're going to see a bill dealing with our economic security, dealing with things as having waivers for penalties and debt and mortgage obligations, increased federal disaster grants for affected small businesses, zero interest guaranteed loans for affected industries, and yes, what we've heard about and we'll continue to talk about, direct cash assistance to qualifying families and some businesses. And at the same time, I can tell you, based on the Central Coast of California and the number of small industries that we have, the hospitality industry and the small businesses are definitely going to be a part of that conversation in Washington, D.C. to make sure that they are made as whole as possible, the employers and especially the employees. Now, there's going to be a number of bills put forward in that matter, but know that, going forward, when it comes to recovery, I also believe that this is an opportunity for us to work together and to craft sustainable solutions to restructure underlying inequities to help those suffering the most, especially during this crisis. I can tell you that what I'm hearing from my members of Congress, my colleagues, in shaping not just this third bill, but looking forward as well in a recovery bill, we're going to be mindful of the experience from previous recovery efforts, from Reconstruction to the New Deal, from TARP and the Recovery Act. And simply stated, these types of recovery benefits are going to be equitable for all Americans, And so tonight, I'm holding this town hall, as I plan on doing next week as well, if we're not back in Washington, D.C. But I'm holding this town hall to hear from you, not just your questions, but also gather information. If you don't have a question, fine, I'm open for statements as well as to what you're going through. So not just I hear about it, but what this community who's on this phone call hears about it as well. This is information, as I've always said, I always use the evidence from my constituents to make my case back in Washington, D.C. You're providing me with that evidence upon which we create policy, and I want to appreciate that. But who is also doing that are the other experts that are on the line, and I want to introduce those to you and allow them to say a few words to you as to what they're dealing with at the local level. So let me just run down the list of experts that are on the line, and then I'll turn it over to them. First, we have Santa Cruz County Administration Officer Carlos Palacio. We have Santa Cruz Health Service Director Mimi Hall. A Santa Cruz County practitioner, Dr. David Ghilarducci. And we have a San Benito ER medical doctor out of Hazel Hawkins Hospital, Dr. Michael Bogie. And finally, we have the Small Business Administration Field Office Public Information Officer, Corey Williams. And so at this time, I'd like to turn it over to each of them, and I'll call out each of them once they're done making their brief statements to tell you about what's going on. I'll start off with Carlos Palacios, the Santa Cruz County Administration Officer. Take it away, Carlos.
Thank you, Congressman Panetta, and thank you very much for all of the support you have been giving Santa Cruz County and all of our cities throughout this crisis. As you know, we're going to rely on both the state and federal government to help get us through this. We have, in Santa Cruz County, we have been operating under the incident command system throughout the crisis. This system is in place for emergencies just like the one we are experiencing now. Our staff have trained for years using this system. We've used it in the earthquakes and floods and tsunamis that we've had in the past, and now we're using it for this new COVID-19 crisis. And let me tell you that the training is paying off, and I'm very, very proud of our county employees and our community. People have just been responding very, very generously and in a very professional way. Our Public Health Department Operations Center has been operational for more than a month, and our county-wide Emergency Operations Center has been operational for more than 2 weeks. The incident command system that we are employing is ensuring that the entire resources of the county are being used to support public health in this emergency. We are also ensuring that we're coordinating with all of the cities in our county, the County Office of Education, and also our colleges and nonprofit community as well. In Santa Cruz County, we have also set up a call center to provide information to the public regarding county services. I know there's lots of questions about county services. We have lots of essential services that are continuing to operate under this crisis. And so the number for that call center is 831-454-4242. That's 831-454-4242. And that is our call center regarding county services. We also have our website. You can just search under Santa Cruz County, which also has links to all of our county departments and the services that are continuing to operate, as well as our Health Services Agency webpage, which has lots of information regarding COVID-19. Thank you very, very much, Congressman Panetta.
Thanks again, Carlos. I appreciate that. Next, I'll turn it over to Santa Cruz County Health Service Director Mimi Hall.
Hi, good evening, Congressman Panetta and all of the constituents. Thank you so much for allowing us this time to speak with the public and educate them and answer their questions. And in Santa Cruz County, on the Health Services Agency side, our Public Health Division, as Carlos Palacios said, has activated our GOC effective about a month ago. And our single broad objective is to protect our community and save as many lives as possible. And so with that, we realize that although we're a small county, we're part of the region where California's epicenter is. So we have joined with our Bay Area counties to put in place health officer orders to shelter in place. And this was followed, I believe it was just last evening, with Governor Newsom declaring a similar statewide executive order. The health and safety of all of you and your families remains our top concern, and we've been working in close partnership with California Department of Public Health and also the Centers for Disease Control to ensure that the quickly changing guidance, the protocols, and the best practices that we need to protect our community are implemented. The situation seems to change daily, and it's very difficult for us as that happens. I would say that our biggest challenges right now are testing availability and personal protective equipment, such as masks and other things for our healthcare workers. And although tests are widely available, it's not prudent to do tests when we have a shortage of PPE. So even though all government at the end of the day is local, we're very proud to be a part of the local actions to keep our entire community safe. And it's critical that we do that at the local level. However, we appreciate all the support that we're getting, because to really, really be effective as a nation, we at the local level really do need that uniform structural and economic support that comes from the federal government.
Great. Thank you, Mimi. I appreciate that. I'll turn it over at this point to Santa Cruz County practitioner, Dr. Ghilarducci.
Well, thank you, Congressman Panetta, and thank you for your leadership in this matter. It's a pleasure to address our community. I'm Dr. David Ghilarducci. I'm the Deputy Health Officer for the County of Santa Cruz, and I'm also the EMS medical director in Santa Cruz County as well as San Benito County, handling the 911 end of things. This has been extraordinary. We have not, as a country, experienced this for over 100 years, and so we are going through some real planning issues. We've been working very hard, as Mimi and Mr. Palacios has said, and you know, our message remains the same. The most effective way to beat this virus is prevention, and that is shelter at home if you have local orders to do so, limiting contact with others to the extent that you can. The social distancing and hand washing are just incredibly important. And for those of you who are so-called millennials, those of you in your 20s or so, a special message to you, and I echo Dr. Fauci on this, is that while your risk of serious illness is not zero, it is lower than senior citizens in our population. But recognize that if you take a more cavalier attitude toward this, you could be exposing your parents or your grandparents, and we really rely on everybody to come together. And I have to say that I'm very impressed with the public response so far. I drive around on the streets in Santa Cruz, and I notice that people are staying home. The roads are empty. I'm hearing from our emergency departments that their volumes are way down. The same thing for our clinics. People are heeding the message. They're staying home and doing self-care. They're using 911 and the hospitals when they need to, which we encourage you to do. But they're also realizing that in many cases, the best place for them to be is at home. So I'm sure we'll have an opportunity to take any questions farther on, but thank you so much.
Thanks, Doctor. I appreciate that. And I think just to reinforce that, I think all of us who are on the call, at least myself and the experts, we're all at our homes or at our work, obviously, if they're doctors. But I know I'm sitting here in Carmel Valley, California, with my daughter who's here, who's been home from school, as well as both my daughters. So thank you and for that, for what you're saying, and this is how it's going to be for the foreseeable future at this point. Let me turn it over to someone I had the honor of the pleasure of speaking to yesterday out there in San Benito County. We had a good phone call and good advice. He'll give you good advice as to what's going on out there in San Benito. Dr. Bogey, if you could, please talk to us about how everything's going out there.
Well, thanks, Congressman. Yeah, we are dug in over here in San Benito. We are Hazel Hawkins Hospital. We're a small hospital with a big job. We take care of the entire county here, the only hospital out here. I think we talked about it yesterday. We were one of the hospitals that took care of 2 of the early cases of coronavirus about a little over a month ago. So we've been prepping for a couple of months now. We knew about this coming. We didn't know about these 2 cases, but we were aware of the COVID threat. So we've been prepping for about 2 months. And then we had these 2 early cases. It was a real eye-opener for us. And we're dug in, and we're starting to see the action now. We're starting to see a little action out here. We've seen Santa Cruz is getting some more action, Santa Clara County, and we feel that coming toward us, and we've seen some here as well. I wanted to talk to Dr. Ghilarducci mentioned, the millennials and how it's important and to not spread this virus. And part of that is not just that the elderly are at risk. The part of it is that if we flood our hospital system with coronavirus patients, we won't be able to take care of the heart attacks and the strokes that come in. And we especially as Hazel Hawkins Hospital, we are a beacon out here, and we need to stay open to be able to take care of so many other emergencies and exacerbations of medical problems. So that's also important. Why it's important not to just go out and spread this thing around. We've got to remember that not just our elderly at risk of coronavirus, but we've got other medical emergencies that we need to be able to take care of. So I'm asking all the citizens just to be active participants in this. And anyway, yeah, we're ready.
Thank you. I appreciate that. Thank you very much, Doctor. And then we've been getting a lot of calls. I can tell you this much. Corey Williams has been very busy and will continue to be busy. And so, Corey, please tell us how it is on the Small Business Administration and what's going on there, and what exactly do people need to know in order to utilize your services.
Well, good evening, Representative Panetta. Thank you so much for allowing us to be on the call. Again, my name is Corey Williams, Public Information Officer with the U.S. Small Business Administration's Office of Disaster Assistance. We're located here in Citrus Heights, California, and since COVID-19 has been declared, the entire state of California, including all the counties, are now eligible for what's considered economic injury disaster loans. So if your small business or nonprofit or small agricultural co-op is in a declared disaster area, which is the entire state of California, and has suffered substantial economic injury, that business may be eligible for an economic injury disaster loan. Now, substantial economic injury means the business is unable to meet its obligations and to pay its ordinary and necessary operating expenses. And economic injury disaster loans provide the necessary working capital to help small businesses until normal operations will resume. Now, the good thing about the program is that now all of our loans for economic injury disaster loans as a result of COVID-19 will carry a 1-year deferment. So that means that the business, the nonprofit, are not making their first payment until 2021. Now, also for the businesses, the interest rate is fixed at 3.75%, and loan terms are up to 30 years, again with that same 1-year deferment. And for nonprofits, it is fixed at 2.75%, and both businesses and nonprofits can borrow up to $2 million with flexible terms up to 30 years for repayment. Again, we encourage everyone to apply online by going to disasterloan.sba.gov, or they can call our customer service center number, which is 800-659-2955. Thank you so much, Congressman Panetta.
Thanks, Corey. I appreciate that. And just to add on to that real quickly, here on the here on the Central Coast, you can also call the following small business development centers: Monterey Cal Coastal SBDC at 831-424-1099. Once again, that's 831-424-1099, and Santa Cruz SBDC, which is at 831-479-6136. 479-6136. And look, if all else fails, know that you can always call my office, the Salinas office, especially at 831-424-2229. Let me make one thing clear. I believe my services and my offices are essential, and therefore we have limited staffing in the office as well as telecommuting for all my other essential staff members that are there. So please feel free to call the office, email the office, and contact us if we can help you in any way with your small business administration loan, Social Security loan, immigration loan, anything else that we can do to be that bridge to the federal government. That's what I always say. As many of you know, me and my services know that our constituent services are a priority for us, and I believe they are essential. That is why we will be open during business hours this week. We have been, and next week as well. So thank you very much. So before we get started, if you have questions, please press 0 on your keypad on your phone and press 7 on your keypad on your phone to provide your email address so we can send you email updates from time to time. And with that, Ian, go ahead and take it away. We'll open it up to questions, please.
Sure thing. Happy to get started, Congressman. Let's get our next question up from Vasiliki. Vasiliki, can you hear me?
Hello?
Yeah, go ahead.
Go ahead.
Okay. My name is Vasiliki Vasile. I'm calling from Santa Cruz. I share the widespread community concerns about the virus itself, personal health, etc.
Hello?
Oh, it looks like she might have lost the line. I've got her question copied here. The question is, concerned about the delayed response. So she's a semi-retired geologist and wondering how prepared are we for normal disasters, mandatory blackouts, who will be picking up the crops, and will we have food? So she's worried, I think, about just continuing the normal operations of the country during this.
Yeah, sure. Look, I will be the first. Well, I think there's other people who are going to be the first to admit, but I will admit, and I believe wholeheartedly, that there was crucial time that was squandered by this administration, I must say. Unlike China, our country actually had the luxury of knowing that this virus was on its way. But I do believe that rather than relying on the best and the brightest epidemiologists and physicians, that unfortunately there were political messages that were used early on to dismiss and downplay the potential disruption to our daily lives and our economy, and actually distract from the vital directive to get ready and to prepare for this. But what we've seen, that void actually was filled, though, like I said, by our governors throughout this country, by our local leaders, and by Congress, I believe, passing bills that affect people's lives in these emergencies planning bills that I talked about. And so, I know that there's an emergency declaration. I know that there are other steps being taken by this administration now that they're taking it seriously, and we do need to listen to them. But at the same time, going forward, I think this is a disease, a disaster, where all levels of government are in this together at this point. And yes, it's, like I said, it's multifaceted, once again, locally executed, state mandated, and federally funded. But I think that's how our government works at times. And I think that, as to what we're seeing, I think it will continue to work going forward. A good example is the food that Vasiliki talked about. Obviously, here on the Central Coast of California, our agriculture, the number one industry by far, is essential. And we know that those employees that are out there and those producers that are out there are essential. And so they're going to continue to work as best as they can to produce the food that we can. And I'm glad to say, I'm actually proud to say, thanks to the leadership of the Monterey County Board of Supervisors, they just put out certain standards, health standards, to protect those that are working in the field. And that's actually online. You can go on the Farm Bureau, you can go on the Monterey County website as well to see that there are certain things going to be put in place to protect our ag workers who are out there in the fields, dealing with their hygiene, dealing with their employer-to-employee contact, the employee-to-employee contact, regular routine environmental cleaning, and training and changes to the processes, as well as limiting non-essential visits and travel. So this just came out today, I'm proud to say, and I want to thank the Board of Supervisors working with our producers, working with our ag employee advocates, and most likely the UFW. Want to give a shout out to them for all of the hard work they have done for protecting our employees and making sure that those essential employees continue to produce the food that we have. Now, on another note, let me just talk about the food banks that we have. We're very fortunate to have very consistent, well-stocked food banks at this point in all four of the counties that my congressional district covers: Monterey, Santa Cruz, Santa Clara, and San Benito. And I've been in contact with all four of the major food banks in each county. There is food there. Obviously, they could always use more donations to help out. We understand that. But at the same time, this is a type of disease that, where it's drawing people, we're directing people to avoid going out in public places. And therefore, this type of disaster doesn't draw people out, it drives them inside. We get that. That's why I have called for the National Guard to step up for humanitarian purposes only, to help pack the food, to help distribute the food, especially to those in our vulnerable communities. And I think we are based on phone calls I've had today, be it with some of the food banks, be it with the state of California. They are on alert. I actually met with a couple of National Guardsmen and women who were at the Second Harvest Food Bank in Watsonville. You got to give them a shout out, doing a hell of a job, who are preparing to be a part of this food distribution network, which I think is going to be very, very important. As the longer we shelter in place, the longer you're going to see closures of businesses. Therefore, the more you're going to have to see people rely on food banks. know that preparation is in place, not only to have the food, but to distribute the food as well. So I thank you, Vasiliki, for that question. I'm sorry you got cut off. Happy to take the next question.
Sure thing, Congressman. This next one comes from Robert, and he prefers that I read it over the air instead of bringing him live. So his question is, testing to determine which individuals have already had the virus and now have antibodies, wondering if they could participate more in their communities if they've already been through the illness.
And let me defer. Let me say something and then turn it over to the medical experts. But I just heard Dr. Anthony Fauci, this 78-year-old expert there. Thank goodness he's in the position that he's at. And it's amazing that the guy hasn't passed out, because he is absolutely everywhere saying what we need to hear based on his expertise and actual science. That we're so lucky to have him in the administration at this point. But he just said that they are not sure. He was asked about that on the McNeil News hour just now at over the 3 o'clock hour. I listened to him, and he basically said they don't know at this point whether or not those who have had it and passed it, there are going to be certain antibodies that they can use. That is what he said. Please, I'd open it up to either of the health professionals that are on the line to answer differently or give your own version of the answer.
Well, thank you.
Go ahead, Doctor.
Go ahead, Michael. You go first.
I'm just going to reiterate, that's exactly my understanding. My understanding is we don't know the answer to that. There's some evidence that they may not become reinfected, but there's also some consideration this could mutate much like the flu does. So I think that the answer is we don't know if once you've had it, are you immune, and can you go out and participate in the community of coronavirus?
Yeah, Dr. Gilladucci here, Deputy Health Officer in Santa Cruz County. I don't have much to add to that. I think both of you said it well. We're operating on the assumption that you can become reinfected. There's evidence that does happen. So we think that the best advice is to operate as we suggest in terms of social distancing and the prevention efforts that I mentioned earlier.
Great. Thank you, doctors. And thank you, Robert, for that question. We'll go ahead and take the next question, please.
Sure thing, Congressman. We've got Janaya up next. Janaya, you're live. Go ahead.
Hi, Janae Kelly. Was calling on behalf of the Monterey Bay National Marine Sanctuary Foundation, of which the Congressman's father is on our board. But I think you answered my question at the onset in the introduction. So I just wanted to make sure that nonprofit organizations were being considered for assistance, since they're particularly vulnerable at this, time of economic instability. But if I might, since I saw kind of where we can be sent for help, maybe I'll pivot and ask another question, which is more in the medical field, and that is, I have personally developed some very, very mild symptoms that seem to be consistent with the coronavirus, and I've been kind of sequestered to my room, and I live with my family. And my question is, how effective is it for me to be in my bedroom when the dog kind of comes, in and out, and they're feeding me and taking my dishes? And it seems like they're probably exposed to anything that I have within our household. But so one question is it really effective for me to stay in my room? And if so, for how long? And because I'm healthy and my symptoms are mild, they're not going to test me. So we don't even know if I really have it.
I'm going to let the health professionals answer that first part. Please go ahead.
Oh, okay. Excuse me. Dr. Gilladucci here. Great question. And, the thing is, if your household, the other people in the household are practicing good hand washing and hygiene as we've recommended, their risk is very low. You can be in the same room with somebody with COVID and be relatively safe, provided you're maintaining social distancing. Probably the most important control measure is hand washing. And so obviously you touch the dog, you touch a door handle, you want to make sure that you wash your hands. One thing that we do, that all of us do, and it's just a habit, is we touch our faces all the time. And so really consciously try to avoid that as much as possible. But you know, I think the effective control measures of social distancing, 6 feet of separation between you and others, and the hand washing are the most important factors.
Dr. Bogie, you got anything to add to that?
I really don't. I just know that you can successfully home quarantine yourself and keep others in your household with safe. That has definitely been studied, and it's possible to do. And Dr. Ghilarducci mentioned the ways to do that, so it can be done.
Thank you. Thanks to both of you. And Corey, I'm going to kick it to you in 1 second. I just want to go back, Janiyah, to those to the nonprofits, and obviously thank you for all you do for the Monterey Bay National Marine Sanctuary Foundation, or the Sanctuary Foundation. But let me just say, look, in regards to, you know, nonprofits and small business loans and the Small Business Administration, you know, Congress took that into account in the recent bills that we passed. $1 billion with a B as in boy, for SBA loan guarantees to support $7 billion in SBA disaster loans, including $20 million with an M to administrate. Both for-profit and nonprofits are eligible. And just to let you know, more needs to be done. We understand that, especially from what we're hearing, not just from you, Janiyah, from nonprofits, but from many people who have called me personally, who have called my office. The SBA is going to be very, very crucial going forward, and I believe more needs to be done. We're asking, we've actually co-sponsored legislation for small business loans to waive fees for borrowers. We've increased, we're hoping to increase SBA loan guarantees to incentivize commercial lenders and issue loans to small businesses. We were asking to increase loan sizes and the federal guarantees for 7 subdivision A loans, including express loans. And we want to authorize $90 billion more for those types of loans over the next 2 years. So a lot has been done, especially with these last 2 emergency packages that were passed in Congress. But I do believe a lot more will continue to be done addressing SBA, profit, and nonprofit. And Corey, if you have anything else to add, especially for nonprofits, since Janiyah asked about that.
Yes, sir, and thank you so much again, Congressman Panetta. The one thing we're really trying to do is make sure we're getting the funds to the small businesses and nonprofits expeditiously. So we've streamlined a number of our approaches in making sure that we've kind of reduced some of the requirements. So one thing that you'll find whenever you're speaking with our virtual customer service representative by going to the 800-659-2955 number is that they're going to not only walk you step by step through the entire process, answer any questions that you may have, but they will kind of and make sure that you're navigating, so make sure your whole process is very smooth. And then the one thing also is that we have the Disaster Loan Assistance Portal, where what we encourage our small businesses and nonprofits to do is check on that status daily. They can log into their Disaster Loan Assistance Portal, see if there's any additional documents needed or any updates on their files. So that's the one good thing about making sure that they have that Disaster Loan Assistance Portal to take care of their needs. So I can't emphasize that enough, to make sure to log into that Disaster Loan Assistance Portal daily, whether you're a small business or a nonprofit.
Outstanding. Thank you, Corey. Ian, first of all, Janiyah, thank you for that question and your work. And Ian, we'll take the next question, please.
Sure thing, Congressman. Let's get Stan up live next. Hey, Stan. Stan, can you hear us?
What was he calling about? Yeah,
looks like he might have walked away from his phone. His question is, my daughter is self-employed at a salon. Is she able to get relief?
Yeah, another question we've been getting quite a bit. And that's something in this third, at least I'm going to let Corey chime in as well. But just to let you know, at the federal level and the congressional level, that's something we're going to be asking for. And I would say will be included in the third package for self-employed coming up. That's going to be you're going to be here discussed and hopefully passed next week. I completely believe that independent contractors like hairstylists and gig workers even. They got to be taken care of. And I can tell you that that's something we are pushing for in Congress. But, Corey, talk to me about any sort of help that the SBA can provide for those who are self-employed if possible.
Okay, so great question with this one. Congressman Panetta, with those self-employed that are actually sole proprietors, such as a DBA, those are eligible for our Economic Interest Disaster Loan Program. It just depends, that's going to be a processing center question if they do not have a business entity of any kind, such as a sole proprietorship, LLC, S Corp, C Corp. The one thing that they still may be eligible for other forms of assistance. It just may not be through SBA if they don't have any kind of business entity such as a sole proprietorship in that situation. But the one thing we want them to do is still apply. There may be exigent circumstances that may be where they may go ahead and get a DBA later, or we're in the process of getting a doing business as. So in that situation, again, we encourage everyone to apply in this situation, as we are doing a lot of changes to our Economic Interest Disaster Loan Program in response to COVID-19.
Thank you, Corey. I appreciate that. And once again, the small development business centers locally are the Monterey Cal Coastal at 831-424-1099 and the Santa Cruz SBDC at 831-479-6136. Thank you, Stan, for that question. Sorry we missed your voice. Appreciate the question. Ian, go ahead and have the next question, please.
Will do. Let's get Elaine up next. Hi, Elaine.
Hi. I'm actually calling on behalf of some very good friends of mine who are Aptos residents. They are currently in Guatemala. They went down there to study Spanish. All flights out of Guatemala have been canceled. Guatemala has closed the borders and closed the airports. They're desperately trying to get home. They've contacted the State Department. They've contacted the embassy. No one is offering them any assistance, and I'm wondering if you have any suggestions for what they could do or what you could do to help them get home.
Yeah, thank you. This has come up in the past 2 days. It's not just, I think you said Guatemala, Costa Rica, Morocco. There's a group traveling over there from Santa Cruz that is stuck over there. Know that we have sent congressional leaders, members have sent several letters to the State Department. I have a letter right here in front of me from Dianne Feinstein. I have another letter sent to Secretary of State Pompeo by close to 20 senators, trying to press them to take care of the United States citizens that are abroad, especially with these orders that we've asked them to come home, yet it's very difficult to get home. Such things have been done, Elaine. In Morocco, we arranged special chartered flights for U.S. citizens or U.S. lawful permanent residents departing Marrakesh International Airport. I'm giving specifics because I'm sure there are people on the line who know people on this group that's in Morocco, considering how many calls we've had into our office. There's going to be it's going to be Marrakesh to London Heathrow, and then there's going to be a connecting flight to 10 U.S. cities served by British Airways. Now, there is a cost. I'll be frank. It's close to $1,500 for these one-way tickets, and they're going to try to make sure that they don't have to pay it right away. That's not going to be paid, but they're going to have to pay it eventually. So know that, one, the State Department understands that. Two, that our government is actually doing something to get these citizens home, our LPRs, legal permanent residents home, in regards to actually chartering flights. I know that in regards to specific countries, I have a sheet here in front of me that has specific countries and to who you can contact in regards to your friends or family members who were down in Central America. Please do me a favor and call our office again at 831-424-2229, and we will give you the specifics. I can tell you tomorrow is Saturday. We are going to be manning the phones, having staff on the phones tomorrow in order to answer these types of questions, okay? But once again, we are making the State Department aware of our citizens who are abroad and need to get home. 2, State Department's actually doing things in regards to chartered flights to get them home. 3, if you actually have further questions, please do not hesitate to call my office at 831-424-2229. Thank you. Thanks, Elaine. Next question, Ian.
Yep, we've got Jody up next. Hi, Jody.
Hi. Thank you for taking my call, Congressman Panetta. I live in Seaside, and I'm a legal permanent resident, and I recently filed for naturalization in January of this year. I work both as a classical singer and as a certified massage therapist, and I am currently very out of work in both regards. Thankfully, my husband has a good job and is currently still working. My question surrounds the newer public charge ruling for immigration and federal and or state assistance that is being made available, like those $1,000 checks that are supposed to be mailed out. Is my journey towards citizenship going to be jeopardized by accepting any assistance the federal government offers my family? Should my family accept this check if it comes, and other things like free COVID-19 testing? If my employer accepts federal assistance, am I receiving assistance by proxy? Does the public charge ruling apply only to federal assistance, or does it apply to state assistance or assistance that I might qualify for as a semi-self-employed individual as well, in the form of these loans or grants that you've been talking about this evening? If my husband accepts it, because I indirectly will be benefiting from it as well, does this put my naturalization in jeopardy too?
Thank you. I appreciate that, Jody. Obviously, dealing with the public charge rule that this administration, unfortunately, and I believe inhumanely, put down, we are definitely pushing back. Clearly, I've always been a advocate against that public charge rule, especially at a time like this. Please know that lawmakers in Washington, D.C., as I said, including myself, have been pushing the Trump administration to suspend the public charge rule altogether because of this pandemic. On top of that, the USCIS, Customs and Border Security, they have said that immigrants who undergo medical testing for the coronavirus or treatment related to it will not be penalized when applying for green cards and visas under the newly enacted public charge rule. So once again, just to tell you, we've received assurance from the USCIS that immigrants who undergo medical testing for the coronavirus or treatment related to it will not be penalized when applying for green cards or visas under this newly enacted public charge rule. Know that obviously dealing with this administration, throughout my time in Congress for the past 3 years, I've continued to push back on this administration when it comes to immigration and these types of senseless and damaging rules, such as the public charge edict. Know that we will continue to push back, especially at a time like this in dealing with this pandemic, to make sure that health and safety of those in this country are taken care of first before complying with any sort of public charge rule is what you're going to see in regards to the fight out of members like myself in the United States Congress. Thank you, Jody, for that, and thank you for continuing to do what you need to do to take care of the health and safety of yourself and your family. I appreciate that. Next question, Ian. Unless any of the experts have anything to say on that?
No, I think you did a great job.
Okay, thank you. Go ahead, Ian. Next question.
Sure thing. We've got one from Brenda. She preferred not to go live, so I'll go ahead and read it. The question is, what resources do hospitals need right now?
I have an idea, but I'm going to defer right now to the experts on that one.
Okay, thank you. Dr. Giladucci here. I have been working closely with our hospitals here in Santa Cruz County. And Congressman Panetta, I know you've directly reached out to Watsonville Community Hospital. But let me speak more generally. The hospitals are working very hard to prepare. They've done, I think, a stellar job in terms of reducing their inpatient population, anticipating a surge of need. This includes deferring elective admissions, elective surgeries, and things like that. They're actually reporting to us right now that their volumes are actually down. And I think, again, as I said before, people are sort of heeding our advice to avoid going to the emergency department unless you really need those services. As far as what else they need, the big thing, of course, is personal protective equipment, as Mimi had mentioned earlier. That's PPE, is often referred to, and this is a critical shortage. I think the irony here is that in the early part, number one, we're following China and other parts of the world, and they've sort of consumed the kind of global supply of these materials. But number two, and ironically, is that we've been burning through our limited supplies pretty quickly and have kind of limited projection of resupplying these. So we're trying to be very careful in how we use them. The hospitals are doing some stewardship of those resources. But I think third, and Congressman Panetta, I think you know this better than I do, the revenues for the hospitals typically operate on fairly thin margins, and they are part of our safety net in our communities. They are losing a lot of revenue because of the cancellation of elective surgeries and so forth. And so this will probably add more stress to them. So I think their reimbursement on the federal level will be important as well.
This is Dr. Bogie. I completely agree with you, Doc. And the only thing I would add is that we just need the public to understand that in this strange time, we need them to just really be participants and understand that we are trying to keep our doors open so when there truly is an emergency that we're able to accept them. And so, don't, in a strange time, we're asking people, don't come if you're not really sick. It seems strange to say it, but that's kind of the idea of this flattening of the curve. And so we're asking you to be participants in that.
And this is Mimi Hall, Health Services Agency Director in Santa Cruz. I wholeheartedly agree with both the doctors on the line. And I'd also like to add that what we're looking at in the next few weeks, hopefully we're really successful at flattening that curve. But what we're anticipating is that our critical care capacity will become saturated and will be tested. So anything that can happen to help hospitals expand that capacity, whether it's by mobile hospitals or alternate care sites or equipment like ventilators, I think that California is really going to need that, and particularly the Bay Area, because we're the epicenter of this outbreak.
Thank you. I appreciate it. Let me just also, I got a great document today from one of our committees. I won't mention it because it's a rival committee that I'm on, Ways and Means, but it actually was a very good a very good product. And it talked about the PPE, which is personal protective equipment, and why are there shortages? And what it says is that, it stems not only from global supplies being depleted after the prolonged COVID-19 outbreak in China, but also because of a surge in purchasing of masks and other PPE by non-healthcare professionals here and abroad. And then it goes on to talk about, what has been done to address these shortages? Well, one, the FDA has worked with the CDC to allow healthcare workers and first responders to use similar respirator masks approved by the National Institute for Occupational Safety and Health, NIOSH. Now, in response also to potential shortages, the CDC has issued interim infection and prevention control recommendations indicating that alternatives to N95 should be considered. Now, what you have to realize, and what this goes on to explain, is that there are two types of masks. There are surgical masks, and there are N95s. And N95s are those masks that are actually do a little bit better job, a lot better job in preventing the spread of germs. Now, people have talked about, what about the Strategic National Stockpile, the SNS as it's called? Now, I think a lot of people are kind of surprised to know this, but there actually was an SNS when it comes to medical supplies, including 12 million medical-grade N95 masks and 30 million surgical masks. However, only about 1% of the 3.5 billion that the Department of Health and Human Services estimates the country will need if the pandemic lasts 1 year. So it just won't be enough. Now, HHS has announced last week that the federal government, we put in a guaranteed order for 500 million N95 masks over the next 12 to 18 months. And we feel that would encourage manufacturers to immediately increase production of those types of masks for healthcare professionals. And yes, where does the Pentagon comes into play, in that they've also announced that they will be providing 5 million masks from the Department of Defense stockpiles to the SNS, with the first 1 million being made available to HHS immediately, and up to 2,000 deployable ventilators will be available as well. Just a quick note, according to this document, there are approximately 160,000 ventilators currently in U.S. hospitals and approximately 12,600 ventilators in that strategic national stockpile. Now, we've also heard about the President's announcement for the Defense Production Act from 1950. He's talked about that in the last 2 days, and he's kind of pushed it over to Secretary Azar of the HHA. Problem is, we haven't heard anything from Secretary Azar on that, whether or not there's going to be a production by a private company for those masks. We haven't heard the specifics at this point. In the meantime, there are adjustments being made with our government to make sure that there are enough ventilators, or at least as much as we have, and the 2 types of masks as well. So just to let you know on that. And I think we are getting to the point where we're going to get to the final question. We'll go ahead and take that, Ian, please.
Sure thing. We've got this one from Darian next. Hey, Darian.
Yes, my name is Darian Sadeghi, and I'm a resident of Carmel. And I have had more than mild symptoms of the COVID-19 virus. I'd like to know, is there somewhere I can be tested? And as I hope to get better, will I build antibodies, or will I give it again? Can I get it again is what I'm really worried about.
Once again, I'd ask the experts to chime in on this, please.
Dr. Ghilarducci here. So our advice right now, testing is extremely limited. We know that the lab capacity is increasing, but unfortunately now there's a shortage of the swabs, that's the testing swabs that need to be sent into the lab. So different issues there. But if your symptoms are mild right now we're not recommending testing. If you feel that you're short of breath or your symptoms are worsening, then I would recommend you be evaluated by a health professional. That might mean doing some vital signs and seeing what your oxygen levels are in your body. But right now, testing is really, because there is no specific treatment for this, the testing doesn't really change the course. We recommend that you presume that you're positive and that you practice the home isolation that we've referred to earlier. Unfortunately, we don't know if you're going to develop antibodies and be immune to this. There is evidence that people have been infected over and over again from other countries.
And Doctor, talk to me. Based on my conversations that I've had with a number of the hospitals over the past couple of days, it seems like you call in and there's got to be certain criteria, from fever to plus the low respiratory symptoms, and then there will be a second set of criteria dealing with, well, then have you traveled? Have you been exposed? Are you over 65? Am I wrong to say those criteria?
No, you're exactly right. Although I will say that the travel question is becoming less relevant because the virus is circulating in our communities. But certainly other medical conditions put you at higher risk of worsening. So I don't want you to delay getting help if you're in that category. If you're over 65, if you are having shortness of breath, and just by, hey, am I able to walk from the couch to the kitchen? Am I able to walk up a few steps without getting short of breath? If you notice that, it's time for you to be seen. We might need to do some x-rays. We would need to do some vital signs. This can develop into pneumonia, in which case we do have antibiotics for that. So again, don't hesitate if you're concerned. But if you feel like you have a mild illness, kind of like a bad cold or flu, and you feel like it's actually improving, it's trending in the right direction, then there's probably little to be gained by going to the emergency department. We do recommend that you call your physician as well, and they can give you further advice.
Okay. Okay. It's amazing how fast time flies when you're talking about something so serious. We're at the hour, and I want to obviously just wrap it up real quick. But I wanted to give Carlos or the doctors or Mimi or Corey, if you had anything final to say, please go ahead and do that at this point.
I just appreciate you taking the time, and this hour was good. We got some questions answered. It's Dr. Bogey, by the way. And anyway, thanks to everybody for being active participants.
Yeah, and this is Mimi Hall from Santa Cruz County Health Services Agency, and I just want to say that there are so many unknowns. We don't know how this current state of disruption, how long it will last, or what the total impact will be to our local economy, our citizens, and our organizations. But what we do know is that our community has been through extreme challenges before, and that we've succeeded through cooperation and valuing the humanity in each of us. And I think that that's what's going to get us through. And thank you very much for this forum.
Congressman Panetta, this is Carlos Palacios, Santa Cruz County CAO. Just wanted to thank you again for including us in this conversation, and also wanted to ensure the public that we as a county and Santa Cruz County and Monterey County and all of our cities are continuing to operate. Most of our employees are essential employees under the definition of the health orders, so most of them actually are continuing to work from home, or many are actually coming into work. So we're continuing to provide services. Our public safety is continuing to operate. We are prepared to continue to offer services, essential services to the community. And also, we're prepared for any other disaster that could happen. I know there's a lot of fear out there, but our county government, our city governments are all continuing to function and are actually ready and prepared to deal with anything that might come in terms of further crisis out of this current one that we're facing right now.
Understood.
And Dr. Gilladucci here, I'm sorry, I cut you off. No, not much to add other than thank you for your leadership, and we're going to get through this together.
Exactly. Good. Okay. Well, Corey, anything on the SBA side of things?
No, again, thank you, Congressman Panetta, for allowing us to be on here, and thank you for your leadership, and we look forward to more teletown halls and more updates.
Great. Thank you. Ian, before I close out, did you have something to say in regards to any follow-up?
Yeah, absolutely, Congressman Panetta. So anybody who didn't get their question answered tonight, if you feel like we didn't cover something or you have something very specific that you need assistance with, you can stay on the line as we wrap up the call here, and you'll have the opportunity to leave us a voicemail message. If you need someone with Congressman Panetta's office to get back to you, make sure you leave your name and your contact information when you leave that voicemail message. And all you have to do is stay on the line at the end of the call. You'll be prompted to press a digit on your phone, and then you'll be able to leave that voicemail message. But make sure you leave your name and your contact information in addition to your question, comment, or concern, and we'll make sure we get back to you in the next few business days as quickly as we can. Back to you, Congressman. Go ahead and wrap up.
Great. I appreciate that, Ian. Thank you for your help on this, and obviously thank you to the experts that were on the field. They've obviously been working on the call. They've obviously been working very, very hard. These were the first ones to respond. We put it out there for people throughout the district, and these were the first men and women who responded to be on the call, and we look forward to having others from other parts of the district on the call next week on the other telephone town call that we look forward for doing next week. And so just wanted to thank all of them for their time tonight, and obviously their service and their healthcare and their business advice dealing with the SBA going forward. So thank you. And also know that my office, I can't stress this enough, as I always have, my office is there for my constituents to make sure that we are that bridge to the federal government and back. We are there to guide you through any necessary issues that you have in dealing with the federal government, especially now during this bruising pandemic. What one of the doctors said is exactly it. Together, we will get through this. It's funny because when you look at it, we are separated right now. We're very separated. But the fact is that we are in this together. Everybody is stuck in the same situation. We really are kind of living the same emotions. We're having the same thoughts and clearly asking the same questions as we saw tonight. And that shows that I think globally, nationally, and personally, this is all of our crisis. And I think we understand that. And I think we understand that this disease, this pandemic, it's going to dampen our human spirit. We understand that. It's going to be tough to get through as we're seeing. But I do believe that with the help of government and with the help of all of us working together, we can make sure that this does not damage our national spirit. And I think together we won't let that happen. And so I just want to thank you, and I look forward to continuing to work with all of you. Look forward to continuing to serve you as best as I can, not just now, but after we get through this pandemic going forward. So thank you again. Look forward to talking to all of you next week in our next telephone town hall. Thank you.